You're listening to the Voice of Reason. I'm Dr. Len Saputo here with Francesco Garapoli. Francesco, today I think we're going to talk about what are the real numbers of how many people have gotten COVID-19 and how many people have died from it. And I think it might surprise you. The numbers that I'm going to look at now to start with are from the CDC. You know, normally you'd think the CDC kind of inflates their numbers. They talk about 60,000 deaths from influenza every year. And the numbers that you hear on TV are more like there are 66,000 deaths in this country so far from COVID-19. What do you think the real numbers are?
It's important to know the real numbers because these numbers have been what's driving people into fear. When they've been hearing the extrapolations on theory, it's been making people scared, rightly so. But now we're starting to get real numbers from the ground. We're starting to look at real data from clinics and doctors who've been testing and watching people who have it. And I think people need to hear this.
Yeah, that's right. Well, the numbers we got are from the CDC, the National Center for Health Statistics, and it shows that as of April 25th, the number of deaths there have been from COVID-19 is 37,000. Now, that's not the usual number we've been seeing. When you get numbers from Bloomberg, which come from where? From Johns Hopkins University, which, by the way, Bill Gates funds.
Yeah, sure.
The number is 66,000. So there's only a difference of about 30,000 there. And when you look at the number of deaths from pneumonia from COVID-19, the number according to the CDC is 16,500 now.
From pneumonia.
From pneumonia. And that's how people with COVID-19 die. So what number do we believe? The 66,000, the 37,000, or the 16? I'm inclined to think that the 16,000 is the real number. Now that's
the only number.
Well,
we have to look at this reality because Johns Hopkins is a lot of extrapolation. That means they take a little bit of information and then they expand it. This can't be real. It's not what we should be making our decisions on.
Well, how do you think they determine who dies from COVID-19 from pneumonia or dies from the flu or dies from some other kind of pneumonia? It's all based on death certificates. And what do the death certificates show? If it shows COVID-19 anywhere on that certificate, whether it's present or it's actually killed you, there's no distinction. And that's why you see these inflated numbers because they're on death certificates. And guess what? What the government funds $13,000 to every hospital for each patient that has COVID-19. And for every patient that's on a respirator, they're reimbursed something like $40,000. Now, do you think there's some incentive to put COVID-19 on that death certificate?
You know, hospitals are a business. People have to know that these are not nonprofit, angelic operations. They're businesses. And when it's just as easy to say, do you think it was COVID that this person died from? Well, it could have been. We'll put it down.
Yeah.
Now, I say that lightly, but we've seen medical doctors, MDs, admit that much and feeling pressured. We've seen videos taken down on YouTube, but we've seen them before they were taken down with doctors admitting that much.
Okay, now, if that 16,000 is the real number, not the 66,000, then you would expect that maybe the hospitals aren't as crowded as you would think. Now, I have a friend, and I'm not going to disclose what board he's on, but he's on the board of a hospital chain of more than 140 hospitals across the country, all over the country. And what he says is the census of their emergency rooms and their hospitals are not what you'd think. Their ERs are empty. Their hospitals and the converted facilities are down 40% below what they normally have before COVID-19. And I saw a video of a couple of doctors in the New York area who were saying, look, there aren't as many patients as you think from this, even though what we see on TV, and certainly what we know is it's certainly the case from a few hospitals there is a disaster. But when you're looking at the real numbers, it's borne out by what you see.
Yeah, it's very interesting. I mean, people like my parents who are 90 years old, they won't go to the hospital anymore. And there's a lot of people like that. They're so afraid to go to doctors and clinics and hospitals because of the fear of catching this COVID-19 disease. So it's really put the hospitals in a very curious situation.
Yeah. Well, how many people do you personally know who died from COVID-19? I bet it's zero.
Yeah,
How many people do you know that actually had COVID-19? I bet it's under 10.
very small number.
Yeah,
Yes, none
maybe a
none
couple.
of those numbers fit the picture that the media has been putting on us.
So what's
That's
happening here? Why is everybody going through what we're going through? Why do we have everybody in lockdown? Why are we being terrorized by the government reports, and who's in charge of them? Those are
well,
questions that are starting to make a puzzle show us something.
well, we're starting to see brave MDs. These are not radical people. These are medical doctors working on the front line saying, what we did in the beginning probably was right. We didn't have enough information. We needed to take the conservative approach.
Right.
And some people even gave Dr. Fauci credit for that in the beginning. Let's take the
Oh,
conservative approach.
he was a hero.
But the big but is that we have now gone through nearly 2 months of this, and the data does not conform to the original estimates. That's the story we're trying to talk about right now.
Right. And you got to remember, we live in America, and people aren't just going to be pushed around. And that's why people are starting to say, I don't care what you tell me to do, I'm not going to obey it. And look at the economic disaster that follows it. And the question you have to ask yourself, and we'll deal with this in another video this week, is do we have more deaths from COVID-19, or are we going to have more deaths from what we do from the shutdown? It's a
Right,
real
from
question to ask.
really the collateral damage. That's going to be a very interesting video.
Right.
I hope people watch that.
Right. So here we are with not knowing the real numbers, although we're starting to figure this out a little bit. And now that the information came out of Stanford, USC, and a study in Germany, they all came out with a number that shows that there are probably 50 times more infections
Right.
that are asymptomatic or mild illnesses, like coronaviruses are every year and have been for 50 years.
Yeah.
And so when you look at the fact that there are a lot more cases, then the ratio of people who actually die from this disease changes a lot. So instead of there being a death rate of something like 3 or 4%, you're down to 0.1%, the same thing that you see with seasonal flu.
That's right. And people are coming out with this data around the world. Even the Stanford research that was done in California, which got attacked when it first came out,
I know.
has been replicated in other countries with similar results.
Same
So,
results.
right. So the thing is, what we all have to remember is that there are people who benefit from this kind of fear mongering.
Mm.
And don't think they're all just corporations or dark side people. The average people you meet on the street who are full of fear
Mm.
resonate with fearful stories. That's why people watch the news every night. So we have to ask ourselves, do I want to be caught up in that? That's a really important question to ask.
Well, here we are. I think we looked at the real numbers the best we can. We're zeroing in on it. The puzzle is starting to show what actually is happening. And maybe it's time that we're going to do something about it, because we can't go on just believing the things that certain people want to tell us to believe, because it's not right. So you're listening to the Voice of Reason. We'll be back with another installment tomorrow.